Well, Director, you're so popular that more people have showed up to ask you questions. So now I recognize Representative Palmer for 5 minutes of questioning.
I thank the gentlelady. Director Cohen, can you name 3 things that you would do differently from the former director of the CDC?
Thank you so much for that question. As I was sharing earlier, I led the COVID response for North Carolina, and I think the lessons that I bring from that are 3 of them. One, a focus on transparency. I think transparency is really important to build trust. I think sharing what you know when you know it, and also what you don't know. I hope you see that already under my tenure and how we're communicating differently. So that is one. Second is a focus on operational excellence. We can't just recommend a vaccine. We have to make sure that we're making access possible for folks. We need to marry the evidence with the operations. We are an operation response agency as well. So that's number 2. And then the third is about relationships. It's really important that we are working as one team. We have to build relationships before a crisis hits so that when we get into those crises, we can make sure to use those. Sometimes public health finds themselves siloed away from the traditional healthcare system. I think it's really important that we bring healthcare and public health closer together.
Well, if the CDC had a sales department, those would all be fine. I'm talking more about actual policy and specifically, would you have shut down the schools? Would you have closed the schools? Is that what you did in North Carolina?
Well, sir, yes, back in 2020, all the schools across the entire country were shut down, including North Carolina, but I did work across the aisle with...
Would you shut them down? Had you been in charge, would you have shut down the schools if this were to happen again, if we had another major respiratory outbreak? Would you shut down the schools?
Well, the good news is we're in a different place than we were before. We both have different tools and different mechanisms to respond. So I can't really address a hypothetical, but I do think we've learned a lot about how to approach things.
Did it harm our students by shutting down the schools?
Well, look, we always knew in-person instruction was incredibly beneficial, not just for
You'd be great in the
education,
sales department. But I'm trying to get to policy, and that's one of the key things that troubles us about the CDC, is that we have to address policy. You know, there's a saying that if you're explaining, you're losing. So we need to get down to policy. We need to talk about the things that went wrong and what we need to do. Masking. You know, you keep... the CDC insisted on masking kids as young as 2 years old and made the argument that there was no disagreement. I think the word is equipoise. I have a study here that clearly shows that there was widespread disagreement in Europe, even here. Yet the CDC insisted on masking kids as young as 2 years old. What would be your position on that?
Well, I would say it's good that we're in a different place and we're able to turn a chapter forward. We have a lot of different tools to protect our children now, vaccines and treatment. Masks continue to be one tool amongst many that we can use to protect ourselves.
So you would continue to require masking for 2-year-old kids?
So, again, we are in a very different place.
I know that, but I'm asking you, this is a policy question. There have been no randomized control trials on masking. And I can't help but think that the CDC didn't want the randomized control trials because it didn't fit the narrative, didn't fit the position they wanted to take. And there's a lot of people, I mean a lot of people, that felt like this was more about power than it was medicine. And if you're going to continue to try to do a sales job, you want to continue to try to explain positions, it's going to be difficult to get us on board with the CDC because people don't trust you anymore. And there's been enormous damage done to science and medicine by the policy of the CDC and the National Institutes for Health and others, Dr. Fauci being the lead candidate for disinformation. So you can continue to come in and do a sales job, you can try to explain, but if there aren't significant policy changes, I think it's going to be very difficult going forward. I yield back.